Hello and welcome to webinar series and also welcome to year 2026. I hope this year brings confidence and success in academics. Thanks to all our viewers from national and international, from district level for your continuous support. Also like to extend my gratitude of thanks to our doctors for their continuous contribution. And so today's topic is all about eye care and aging, and few essential tips will be given by our expertise, who is none other Dr. S. Hussain Naqvi ji, who is our senior consultant, glaucoma, LASIK, and cataract specialist from Yashoda Hospital, Somajigoda. I welcome you, sir, as we are trying to learn from you because as we age, we do experience a lot of vision changes. Yes, sir. We are
Thanks,
honored to
madam.
have you.
Thanks for the opportunity and wish you all a very happy new year. Thank
Thanks,
you.
sir.
Thank
Yeah.
you, sir.
Now I like to, request all the speakers to introduce yourself. Yes. Over to you, Princey.
Hello everyone. I'm Princey, and very happy New Year to you all. I'm working in government hospital, chest hospital in Eragata. I have 15 years of experience in various sectors. So now today I'm very happy to be here with you all. Thank you.
Thank you. Yes. Yeah, Pavitra, are you there? Yes, Pavitra. Okay, so I request the technical team to just check with the Pavitra. And here, this session is going to be very time bound. And the first, insight we like to understand from you, sir, is like a lot of things, a lot of technology, a lot of minimally invasive procedures are happening in ophthalmology department or division. So my first insight I like to understand from you is current technology in ophthalmology safe and widely adopted, sir? Yes, over to you, sir.
Yeah, see, whenever we go for a new technology, the concerns which are looked for is the safety and the efficacy, both the factors. So,
Yes.
like earlier times, for a simple example, to quote, after we put a lens for a cataract surgery patient,
Yes.
the capsule which we preserve to keep the lens also becomes opaque over a period of time. So
Yes.
before the advent of this lasers, like YAG laser is the laser which is used to disrupt that, the technology to remove was only a surgical one. So from that, it has been made simple to a laser. So it's like that way it is more efficacious and it is also like less invasive. We a thing which was a surgical has been converted into a medical treatment. Same way for the laser cataract surgery. Like we call it as laser cataract surgery, but basically it's an ultrasound. Okay, so
Yes.
phacoemulsification. Earlier we used to make a big incision of 6 to 7 millimeters on the eye to take out the lens and put an artificial lens. But now with the advent of this technology, we use hardly 2 millimeters of incision to introduce the phaco probe, and we emulsify the lens, we liquefy it, suck it up, and place a foldable lens through the
Yes.
same opening.
Yes.
So the healing time will be very fast. The very next day, the patient will be able to see the things smoothly, and the post-operative refractive error will also be less because the
Very
incision
well.
made is stigmatic free.
Yes. So, sir, when yes, very rightly as you said, a lot of advancement is happening. So, should I take or understand it as a non-touch technique as well? Because when we a few of our staff when they go for this laser, procedure, and they say it is all very good, and these are all like non-touch technique. During that method only nowadays lasers are happening, sir. Is it so, sir?
It's like it's we cannot say it as non-touch, but it's non-invasive. That is a rather a proper
Yes.
word because most of the time we need to position or we need to stabilize the eye using a lens so that the
Yes.
patient doesn't move the eye when we do the laser. So it's
Yes.
less invasive. It's not no touch, but it is less invasive.
Yes. Yes. So yes, because I think the ophthalmology, we just whenever we see a bedside nurse, maybe post-operatively or intra-op nurses, they nicely scrub, and it is a matter of only dilatations, and then that's how the duty ends there. But that is how we are here to learn. Yes. So what are the few common eye problems associated with aging? As we are talking about the eye care, relatively with the aging. So I tried to, just browse on and got few conditions like cataract, glaucoma, diabetic retinopathy, and AMD, etc. So yes, sir. What are the few very common eye problems? because you are the expertise and you get to, view and witness and do the
Yeah.
interventions for a lot of your clients. Yes, sir.
The problems are reversible and irreversible. Like
Okay.
as you said, the cataract is the leading cause of reversible blindness. Like once you remove that opacified lens, see, our
Yes.
natural lens will be something clear like this.
Yes.
Okay, so it is positioned somewhere in the eye here.
Yes.
But
Yes.
as we age, like how our hairs they turn gray, same way the lens fibers also they turn gray and white. So this is called as cataract. So then it won't
Yes.
allow the light to pass to the retina.
To the
And
retina,
when
to the
light
image.
doesn't fall on the retina, the process of vision is not initiated. So that is how it is. So aging change, the most commonest is cataract. Then there are some irreversible causes. Irreversible causes, the leading cause is glaucoma. So above 40 years of age, in 50 age group, 50 plus age group, the prevalence of glaucoma is as high as 14 to 20%. And overall population prevalence is about 4%. So 1 in 4 individuals, they have glaucoma. Then there are comorbidities associated diseases, like those who are hypertensive, they may have hypertensive retinopathy, they may have vein occlusions. Those who have diabetes, they can have diabetic related changes in the retina, like bleeding from the retina from the new vessels. Then
Yes.
age-related macular degeneration happens not in everyone, but in about 8 to 10% of the individuals, wherein there will be a deposit of metabolic byproducts in the macular area. This is again a dry and wet type. And presbyopia is normal aging change wherein the lens loses its capacity to accommodate. Like
Yes.
lens is very flexible. So as the lens fibers, they become more or more denatured, collagen fibers. So then it loses its molding capacity. So when it doesn't mold, we need extra help to see the things, near things clearly. So that
Yes.
condition is called as presbyopia.
Yes, so very, interestingly, we are trying to understand, yes, because these things are very new for us, yes. So we do have a speaker, Pavitra. Are you there?
Yeah, yeah, yes, ma'am. Sir, actually, I wish to know the people with diabetic or hypertension is really facing high risk, sir, as well as which age of this age related to problems will start, sir, actually.
Yeah, there are two factors which influence
We have
these.
to know that.
Yeah, which influence the like onset of diabetic retinopathy and hypertensive retinopathy. One is the duration of the disease. Second is the control of the condition. If the control is good, then the onset of the changes, that is diabetic retinopathy and hypertensive retinopathy, will be delayed. So I have patients who are following up for 10, 12 years also after having the diabetes without any changes. And there are some patients who have 2 years of a disease, but because of a poor control, they have bad diabetic retinopathy. So both these factors, like it is duration bound as well as it is control bound. So both the factors should be, they are responsible for like outcome of the condition.
Yes, yes, yes. So yes, Princey, over to you for your description.
Sir, as you have explained about cataracts and glaucoma, those are all age-related eye issues. So, what are the causes of age-related eye issues?
See, as we age, there are certain denaturation changes which happen in our body. Okay. Second thing, there are antioxidants in our body which prevent this aging of the cells. So that antioxidant levels in our body, they go down as we age. So
Yes.
these are the factors like lack of antioxidants in the body and the denaturation of the proteins or fatty acids over a period of a time, which are responsible for at the biological level for these changes to occur.
So sluggishness of collagen levels and antioxidant levels, that's the reason when we, get to see this eyes aging. Eyes do age. Yes.
Yeah.
Yes. Over to you, Pavitra, for the rest of the discussion. Yes.
Yeah, yes, sir. I wish to know the which age of childhood or adults or most eye problems will increase due to the digital technology, sir. Is that really the thing is right, sir? And we have to know however the effect on to our brain health, sir. Actually, it is.
Yeah. See,
Sir, one thing is, just a minute. Sir, one thing is this digital. Nowadays, you see all the, not only children, even whenever we go home, we also, apart from our basic activities at home, we are also, we spend a lot of time on the screen. So, and this causes a digital eye strain, so please put your insight on the same, because everybody, maybe we are also working in the corporate level. We do also have this, computer, laptop, and desk-bound jobs, and also really please provide a few of your tips. How should we avoid all this? Yeah, over to you, sir. Thank you.
See, after this COVID era, no age group is spared from this digitalized strain, because that was the
Yes.
period wherein the children were introduced to all these gadgets, and they have not left the gadgets after that. So
Yeah.
even children are at risk. Anyone who has a screen work of more than 4 to 6 hours in a day is susceptible to get digital eye strain. So that is because there are certain phenomena, like we are continuously doing a near work. So
Yes.
that involves lot of accommodative effort on our eye. So eye muscles, they get tired, and as well as our blink rate goes down. A normal person blinks about 18 to 20 times or even more in a minute. If you see
Yes.
a person without he being aware of that you're watching him, we see them that they
Yes.
blink 15 to 20 times in a minute. So when we are doing a near task, because we are alert, the signals to blink, they go down, and our blink rate goes down to less than 4 also. So that causes the tears to accommodate or accumulate in the near the lower lid, and they don't spread over the cornea. So
Yeah.
that also causes dryness. That is first thing. Second thing, the radiation related effect onto the cornea, which leads
Yeah.
to dryness. The quality
Yes.
of the tears goes down, and this leads to frequent break of the tear meniscus. So
Yes.
these are the factors, these are the pathology behind the development of the dry eyes because of the digital strain. So what
Yes.
we can do about it, like for all the three steps, like if we are blinking less, we should intentionally blink 3 to 4 times in a minute. Then to reduce the stress of accommodation on the eye muscles, the ciliary muscle and
Yes.
the lens fibers, what we can do is we can have a look at a far off object sitting at your place, what is
Yes.
called as rule of 20. Look at a 20 feet distance apart every 20 minutes for 20 seconds, so that your muscles of the eye, they relax. Then third, still if you have to work for more than 6 hours a day, you can use some good preservative free lubricant, so that your tears are they get replenished, they get
Yes.
a supportive external environment. Then fourth thing, on your system, you can change the brightness, you can change the font size, you can make
Yes.
it like little more eye friendly.
Yes.
And in addition to that, there are posture related problems also associated with
Yes.
that. So we have to
Yes.
see that our posture is also appropriate. Like our back should be straight, our neck should not be too stretched or too bent. So that will also lead to other postural problems. So these are the measures which will help us to take care of the digital eye strain.
Yes. Very productive insight and tips you have shared, sir. Yes, because nowadays we see even everybody goes to the bed, and from there they, operate their mobile and smartphones. Yes, and as Pavitra asked, rightly, it does affect about on the brain health also, sir. Yes, as you said.
Yeah, see, thing is that our body has a circadian rhythm in us. So we
Yes.
have certain hormones which are produced according to the exposure to the sunlight, or to that matter, the light. The most
Yes.
important of them is melatonin. So
Melatonin.
when we are awake, just browsing through our gadgets, lying down on our bed, that melatonin doesn't get produced. So that alters your sleep cycle. And sleep is very important for the brain to recover from the day's work.
Yes.
So that way it has its influence on the psyche of a person also. These kind of conditions are called as psychosomatic effects. Psychosomatic effects of looking at a bright light, especially in the night time.
Yes. Yes, and as rightly you said, and like so, these group of children or maybe adults, they often visit to you, and they contact you. Then you do the assessment like 2020 rule, etc., and then you provide your interventions. Sir. Yes,
Yes.
yes,
And then we also, like for kids, there are certain things, like for adults, the growth of the eyeball, it stops around 16 to 18 years of age. But for kids,
yes,
when they are looking at this near work or they are doing a lot of gadget work, That's a kind of a stimulus for the eyeball to grow.
Yes.
Near work is a stimulus for the eyeball to grow. So that will increase their number out of proportion. So for them, these days now we have some extra kind of stuff, like we have defocus glasses for kids, which would
Yes.
make the peripheral defocus so that their number doesn't increase. Then we have kind of an Ortho-K lens, which are like a contact lens, which are placed on the child's eye at bedtime. And when he gets up, he has a kind of a molded cornea. So that is said to help him out. So these are some kind of features which help to prevent the number from increasing rapidly.
Yeah, otherwise, in previous, 10 years back, or like we used to see child, as the growth spurt is increasing, the child's vision, readings are also and that used to increase like
Yeah,
2.75.
yeah,
I used to see school ages children with a lot of heavy
yeah.
frames and glasses as well. Yes,
So
as
till
like you
18
said.
years of age, the number can increase. So to
Yes,
counter that, we have special drops called as atropine eye drops, which are used once at bedtime. Then we have defocus glasses and this Ortho-K technology. These are the three techniques which we use in our practice to prevent the number from increasing rapidly.
yes, yes, Principal.
Sir, we know that we have two eyesight problems, like myopia and hyperopia. Is myopia is most common among children and hyperopia common among all ages?
Yeah, that's true. Basically, what they say is we are going to enter into a pandemic of myopia very soon. So the dynamics is such that the prevalence of myopia in 2019 census was about 6 to 8% of the kids, they had the myopic glasses. But the same thing now from 2009 to 2019 now. To 2019, it has increased to 20%, and by 2040, it is said that it will increase to 60%. So that is all the effect of having a lot of gadget use in our children's curriculum and their day-to-day activities. So the
Yes.
myopia is more prevalent, definitely, and it's going to be next big pandemic in the society.
Yes. So, yeah, Pavitra, do we do also have little food concern or supplements, etc.? Yes, Pavitra, over to you. Pavitra. Okay. So, sir, yes, we always heard from our elders and a traditional way of educating us that few foods will definitely give your vision like improved. Like, are these any food deficiency responsible for eye problems like weak vision, anything like, or should we take any eye supplements like as we age and we contract this eye vision changes, and sometimes we don't, not even sometimes we don't go for the checkup. We think that
Yeah.
yes, everything is okay, vision blurred or maybe little disturbances are felt, but still we don't go. So yes, sir, the food or any supplements, would you like to
Yeah,
just give few
those who
tips?
those who are taking a good balanced diet, for them deficiency related problems are less. But it is
Yes.
more prevalent in the society which is like below poverty line, wherein they don't get to have a balanced diet. So in kids, vitamin A deficiency, for the same reason, the government has supplemented it with vitamin A drops. So that is being given to the children after their birth to take care of this vitamin A deficiency. Then regarding this lutein, zeaxanthin, they are set to delay the prevalence, delay the onset of age-related macular degeneration. But if you look at all our greens and yellow fruits, they have a lot of this lutein and zeaxanthin. So if you are taking our good diet, then their supplements may not be needed. But anyways, those who have already had the onset of these conditions, we do give them the supplement with a special AREDS formula, age-related eye disease study formula it is. It's called as AREDS formula, which contains all these micronutrients and microminerals, including zinc and cobalt. And
Yes.
omega-3 fatty acids, yes, for them those who don't have non-veg food, or those who don't supplement it in another forms, then they tend to have dryness in the eyes. And for dry eye conditions, omega-3 fatty acids are also given as a supplement to take care of the dryness in their eyes. So this is the broad role of this vitamin A, lutein, zeaxanthin, and omega-3 fatty acids. A natural good source of omega-3 fatty acids is fish.
So yes, the main subtopic, which is again your tips, and you're going on sharing a lot of very productive tips, which is not even known to many. Yeah, as you said about omega-3 fatty acids and all. So what are the few tips you would like to again provide? Like as to the viewers, not to neglect eye health, because many nurses do have the eyeglasses, and sometimes when we ask, they don't go for the checkup, and they are not knowing what is happening with their eye health, sir. Yes. How frequently the checkups to be done for adults, those who are with already existing known conditions? Yeah, because sometimes they just go to, optometrist. They are not even professionals, I think. Yes. They only sell the glasses. At the same time, they have small divisions where they just give their own prescriptions. So, yes, sir. Your insight on the same, sir.
Yeah. So, believing that a person doesn't have any of a pre-existing eye condition, an annual eye examination is good enough. We should include a dilated eye examination of the retina as well, especially for those who have minus number, because those kids who have minus number, they can have a weak periphery, they can have some retinal holes or tears, which requires attention. Otherwise, they end up in bigger problems. So that is for individual who have a normal eyes. But suppose
Yes.
if some condition is there, like comorbidities like diabetes or hypertension, they should have more frequent, like once in 6 months. If you have glaucoma, once in 3 months, a pressure checkup is mandatory. So based upon the status of the eye, the follow-up is recommended. But for a normal individual with just a refractive error, an annual good eye examination is sufficient enough.
Sufficient. Yes. Yes, as you discussed about the 2020 rules as well. And yes, Pavitra, I think, yes, you want to take
Yeah.
this. Yeah.
Yeah, yes, sir. I wish to know that this UV rays are affecting to the eyes really, sir. It is so we know to the few tips to avoid the photokeratitis, sir.
See, photokeratitis is not as prevalent in our tropical area. Keratitis means involvement of cornea, but we
Yes.
do get a lot of pterygium cases in our subcontinent. If you see a
Yes.
mass growing on the eye, that is growing from the conjunctiva onto the cornea, that is an effect of a UV radiation. It's quite common among those who work in the rural areas, especially in the fields, those who do
Yes.
the field work. So for them, and we cannot even tell them to wear a cap with a
Yes. Yes.
extended, because they are
Hat or
exposed to it. So they are
yes.
bound to suffer from those conditions. So sunglasses and all this, that is something which is out of question for them. But those who have to take,
Yeah, sir. Sir, actually, sir, it is really comfortable with the over glasses is really effectful, sir.
yeah, the coating, anti-reflective coating, if you go for good branded specs, definitely it will help. So we recommend to all our patients who have more of outdoor
Okay, sir.
activity, like those who are in the marketing field or those who are working on the screens, to go for anti-reflective coating, which would shield your eyes from the harmful effects of the UV radiations. So
Yes.
it does benefit anti-reflective coating to your even normal reading glass.
So I myself have this doubt. I was waiting for since long to ask from your, and like when you use this contact lenses, sir, like is it for eye fashion? Because I myself wish to wear, but what are the little few conditions which we should be always adhere to? Yes, because we see, people
Yeah,
wear different shades of.
contact lenses are quite freely available, and any person
Yes.
can use it. But as a doctors, we advise those who are using contact lens on regular basis to avoid its use for more than 6 hours in a day. Because our cornea, it receives its nourishment from the atmosphere. That is, it gets its
Yes.
oxygen from the atmosphere. So when you are putting a contact lens, you are creating a barrier between the atmosphere and the cornea. So
Yes.
cornea tends to receive less of oxygen. Then it may develop peripheral vascularization, which can affect the cornea health in future. So that is one drawback of the contact lens. Second, if you are using a long-term use contact lenses like yearly disposable or quarterly disposables, then what happens is, if you don't maintain the hygiene of the contact lens, if you don't
Yes.
clean it
Yes.
with enzymatic solutions properly,
Yes.
then there can be a deposits on the contact lens surface, which can lead to development of a contact lens related allergic conjunctivitis. That is one thing. Second thing, risk of infections would be more. And God forbid if a person gets a corneal
Yeah,
ulcer,
thank you, sir.
it is like going to be it is like going to affect the vision permanently. So the best is to use daily disposable contact lenses
Yes,
if you are
yes.
using.
Yeah, so we have just reached to the end of the discussion, sir, and that was very wonderful insight provided by you. And I urge all the viewers not to have any self-prescription method of, managing your eyes, because eyes are very vital organ in your body. And one more thing is, yes, I keep going through your health talks and short reels. And we request all the
Thank
viewers to
you.
just refer our website yashodamail.com for academic updates and health talks, as we will also further connect, sir, because how cataract affects your vision and why the eyes are getting blurry. At the same time, the reels which I was looking at is dry eyes, whether it is due to
Yeah.
the screen sleep or stress. Yes, we urge all the viewers to just go through for the more updates, and we end the session. Thank you for your valuable time, sir, and thank
Thank
to
you.
all the speakers as well. Thank you, sir.
Thank you.
Thanks for
Thank
the
you.
invite, madam. Thank you. Thanks
Thank you,
everyone.
sir.
Thank
Thank
you.
you.
Thank you.